All right, let's dive in. Today, we're all about nursing assessments.
Yes, specifically Chapter 12 from the Saunders NCLX review, the physical assessment of adults.
It could be a lot, all those details, but I think this will be pretty interesting, not just memorizing facts.
Totally. Think of it like a detective's handbook, figuring out what's up with a patient.
Ooh, I like that. So where do we start? Fancy equipment.
Actually, just talking, it's all about that health history first.
Their story, like what they're worried about, their past, all that.
Exactly. Their concerns, lifestyle, family history, it's all clues. We call it subjective data.
More than a checklist then. Really listening.
You got it. And just watching them, you learn a lot too. Posture, how they're talking, even what they're wearing.
Huh. Never thought of it that way. Body language before we even touch them.
For sure. And speaking of touching, that's the physical exam where we really start solving the puzzle. We'll go step by step, head and neck first.
Okay, so picture this. Nurse checks the head. Is it symmetrical?
Right, looking for swelling, anything unusual. Then they gently feel the skull, any bumps or tender spots.
Got to be gentle there.
Absolutely. Explain everything, make the patient comfortable. Then down to the neck, that thyroid gland check.
The swallow and austere thing, right? Always wondered about that one.
Haha, yeah, it can be a little weird, but it's important. Checking if it's bigger than it should be, or moving oddly. And if it is big, listening for a brute, a sound that could mean too much blood flow there.
So even sounds are clues. What else in the neck?
Lymph nodes, tiny things, part of your immune system, if they're swollen or hurt, could be fighting something off. We feel all over the head and neck for those.
How do you remember where they all are?
Lots of them, but you get a feel for it, like connecting the dots. Behind the ear, in front, under the jaw, sides of the neck, above the collarbone.
Okay, head and neck done. What's next?
The eyes. Starting with that Snellen chart, see how well they see far away.
The letter chart. I remember squinting at that as a kid.
Classic, but also how well their eyes move, extraocular movements, follow my finger without moving your head, that sort of thing.
So eyes darting back and forth. What if they're jerky?
Could be muscle or nerve problems with the eyes, a sign to check further. And then the pupils, size, shape, how they react to light.
There's that reflex, right? Shine light in one, both constrict.
Exactly, the consensual light reflex, cool while the body works. And to document that, we use PERLA.
PERLA rings a bell.
Pupils equal, round, reactive to light, and accommodation. Got it all covered.
All right, eyes inspected. What's next on our face tour?
Nose and sinuses. Checking if the nose looks symmetrical, if they can breathe through both sides, then the speculum.
Ooh, yeah, not the most fun part, I hear.
Not a highlight, no, but tells us a lot. Redness, swelling, if there's any goo in there, sign of infection, all that.
Small price to pay for info, I guess. And the sinuses, how's that checked?
I feel. Gentle pressure on the ones above the eyebrows and below the cheekbones. If it hurts, could be congestion, infection, something like that.
This is making me realize just the head and neck, so much to learn.
It's true. And now for the part some students find tough, cranial nerves.
Ah, yes, those. I remember feeling overwhelmed by all of them.
Understandable. 12 of them all do different things in the head and neck, but the assessment systematic practice makes perfect.
Give me an example. How do you test one?
Sure, take number 7, the facial nerve. It does taste on the front of your tongue and controls your face muscles.
So how's that tested?
Could be, tell me if this is sweet or salty, then smile, frown, raise your eyebrows.
Haha, that sounds kind of fun. What about hearing? Which nerve is that?
That's number 8, vestibulocochlear. We might use a tuning fork or just whisper in each ear, see if they hear it.
Makes sense, but that one also does balance, right?
You got it. So we might watch them walk, any wobbles, or do specific tests like Romberg, where they stand, feet together, eyes closed, see if they swear.
Cranial nerves, lots to learn, but more about watching and interacting than fancy tools, it seems.
Definitely. And it's amazing what those little signs tell us about the nervous system.
Okay, covered a lot already. Next section.
Yep, let's do it. Male genitalia assessment now. This can be sensitive for both patient and nurse, so gotta be professional, respectful.
Gentle approach, clear communication, I imagine. What's actually done?
Visually checking the penis and scrotum, any redness, swelling, discharge, sores. We're all looking at symmetry. Fun fact, the left testicle usually hangs lower than the right.
Huh, didn't know that. Important to know what's normal then.
Totally. Then we feel the scrotum gently, checking for lumps, tenderness, anything unusual. Important for things like testicular cancer.
Anything men could do at home to catch that early.
Absolutely. Testicular self-exams. Once a month in the shower, feel for any changes. Easy and potentially life-saving.
Taking charge of their health, that's great. Speaking of which, what about safety and infection control for the nurses themselves?
Oh, that's vital. Goes hand in hand with everything we do. Let's start with electrical safety. Might seem basic, but super important in a hospital.
Okay, what's key there?
Making sure everything's grounded.
The third prom on plugs, you mean?
That's the one. It lets electricity escape safely, prevents shocks. Always check cords, no fraying, no damage, and any dodgy equipment out of service immediately.
No messing around with that stuff.
Nope. Faulty equipment is dangerous. Even a small problem can be a big deal.
Makes those little checks seem a lot more important. What about fire safety? Big concern in a hospital too, right?
Absolutely. We got to prevent them and know what to do if one happens.
So how do you stay prepared?
We use the RACE mnemonic.
RACE. Tell me more.
It stands for Rescue, Alarm, Confine, Extinguish. So first, get anyone in danger out. Then sound the alarm so everyone knows. Next, contain it, close doors, windows, stop it spreading. Finally, if it's safe, put out the fire.
Handy way to remember, breaks it down.
Exactly. And prevention is key too. Look out for overloaded outlets, flammable stuff stored wrong, those kinds of hazards.
So electrical and fire, check. What other safety stuff do we need to know?
One big one is restraints.
Ah, yeah, tricky topic. Sometimes necessary, but they can be, well, restricting.
For sure. It's always a last resort. Only if nothing else works and the patient's going to hurt themselves or others.
Not for convenience or to punish them.
Never. Doctor's order needed, constant monitoring, documenting everything. Ethical and legal stuff there.
Clear communication, careful thinking. Sounds vital.
It is. Now shifting gears to protecting both of us. Infection control.
Ah, yeah, the basics. Hand washing, right? But there's more.
Hand hygiene is the foundation for sure. But we also use PPE, personal protective equipment, barriers between us and the germs.
Gloves, masks, gowns, like suiting up for war.
Good way to put it. What we wear depends on the situation, how risky it is, and there's the right way to put it on and take it off to avoid contamination.
More to it than just throws on gloves.
Yep, technique matters. Protects us and the patient.
So hand washing, PPE, that's the usual, but sometimes extra precautions.
Absolutely. Transmission-based precautions. If someone has, or we think they have, an infection that spreads easily through air, touch, droplets.
Like someone coughing a lot, they'd be isolated, special gear to go in there.
Exactly. Stopping the spread to other patients, staff, everyone, breaking that chain.
Seems like layers of protection all the time.
It is. And speaking of things that can spread and be dangerous, bioterrorism.
Like in the movies. Sounds scary.
It's a real concern. We got to be ready.
Okay, what do nurses need to know about that?
First, what those agents are. Anthrax, smallpox, botulism, things that could be released on purpose with terrible results.
Anthrax, yeah, remember learning about that, the bacteria.
Scary stuff. But even more important, knowing the early signs if someone's infected. Catching it early is key to stopping it spreading, saving lives.
So nurses are kind of like the first line of defense.
We are. Report anything suspicious, know the emergency plans at our hospital, all that.
Big responsibility, but also you're protecting people.
Exactly. And it shows nursing's more than just being at the bedside. We're advocates for our patients and for public health.
Wow, that's powerful. We've covered so much already. Basic anatomy to bioterrorism.
We have, and now, time to test that knowledge.
Bring it on, those NCLX questions. Ready to show off my detective skills. Okay, game on. NCLX time. See if I remember everything.
Let's put those brains to work. First one, what does PERLA stand for?
Perla, that's from the eyes, right? Pupils equal, round, reactive to light and accommodation.
Nailed it. Classic mnemonic. Now let's apply it. You're doing a head and neck exam, find one of these, which needs action like right now.
Ooh, serious stuff. Okay, let me think. A, trachea midline. B, big lymph node, but doesn't hurt. C, trachea's off to the side. D, thyroid goes UP when they swallow.
Analyzing those findings, good. Which one's the red flag?
I'm going to say C, trachea deviated. It's supposed to be in the middle, so if it's not, bad news, right?
You got it. Could be a tension pneumothorax. That's where air's trapped in the chest, pushing the trachea over. Life-threatening stuff.
Yikes, yeah, that needs help fast. Okay, next question. How do you assess the abdomen? What order? Ah, the abdomen. This one tricks people. Is it A, look, feel, tap, listen? B, look, listen, tap, feel? D, feel, tap, look, listen?
Visualizing it. We don't want to mess up the bowel sounds before we hear them, so I'm going with C. Look, listen, tap, then feel?
Correct again? Seems weird to listen before touching, but makes sense.
Yeah, like listen to a quiet room before you start making noise. All right, 2 for 2, feeling good. What else you got?
Switching to safety now. Remember RACE for fires.
Rescue, alarm, confine, extinguish. Yep.
Perfect. So you're working. Suddenly, fire in a patient's room. What's the very first thing you do?
No brainer. Get the patient out, rescue, then everything else.
You got it. Safety first, always. RACE is there for after the immediate danger's handled. Now, trickier one. When are restraints okay to use?
This is where it gets ethical, right? So is it A, just to be safe if they're confused? B, so they don't wander off? C, if they're being difficult, like a punishment? So is it A, just to be safe if they're confused? B, so they don't wander off? C, if they're being difficult, like a punishment? D, only if absolutely nothing else works and they might get hurt? Carefully considering, good, we talked about this, restraints aren't a light decision.
Right, never for convenience or to be mean. So it's got to be D, the last resort to prevent harm.
You're right on, only when it's to protect them or someone else and nothing else has worked. Serious stuff.
Yeah, reminds me, we're there to help, not make things worse. Okay, hit me with another one. I'm on a roll.
All right, bioterrorism time. Which of these is not a usual anthrax symptom?
Anthrax. Okay, let's see. A, fever chills. B, bad headache. C, ulcers on the skin. D, jaundice.
Thinking back to what we said, which one doesn't fit?
Jaundice, that's the skin turning yellow, liver stuff, right? Doesn't sound like anthrax to me. So D.
You're good at this. That's right. Jaundice isn't typical. The others, yeah, it could be anthrax signs.
Phew, so much to remember. Like my brain's a medical textbook.
It kinda is, and gotta keep it up to date, especially with those rarer threats. Okay, last one for this round. Which cranial nerve does hearing and balance?
Oh, cranial nerves, those were fun. 12 of them, all different. The one we want is number 8, vestibulocochlear.
Boom. Perfect score. You remembered it.
Haha, like I passed a quiz show. Guess studying does pay off.
You've been great, really using what we talked about, not just repeating it.
Yeah, feeling more confident about assessments now. So much you learn just by looking, asking, knowing what to look for.
That's what it's all about, knowledge, thinking it through, really wanting to understand the patient.
I'm curious now, what makes a really experienced nurse good at this? Beyond just the steps.
That's a great question. Perfect for the next part of our dive, actually.
So we've gone through the steps, even practiced some questions. But out in the real world, what makes a nurse really good at assessments?
You're right. It's more than just the steps. It's using that knowledge, thinking critically, seeing the whole picture. That's the skilled nurse.
Like knowing the recipe doesn't make you a chef, right? You need that experience, the intuition.
Exactly. Let's take lymph nodes again. New nurse, they might just feel, yep, there's a lump, done.
But someone with more experience, think about what it means.
Right. Does it hurt? Is it stuck? Or can I move it? What's their medical history? Connecting the dots.
Reminds me of shadowing a nurse, cardiology unit. Patient had heart failure. She noticed his neck veins were bulging.
Interesting. What'd she say about that?
It meant pressure in the circulatory system. Bad sign for heart failure, she said.
See, that's using what you find to make judgments. It's not just, here's the data, it's, what does this mean for this patient?
Like they've got a map of the body in their head, and they're looking for landmarks, but also detours, things that are off.
Love that. And that's even more important when it's subtle, not so obvious.
Like what? Give me an example.
Say, older patient, kind of confused. New nurse might think, oh, they're just old. But the experienced nurse, they dig deeper.
Looking for other reasons why they might be confused.
Exactly. Is it meds? Are they dehydrated, UTI, or worse, like a stroke? Don't assume, gather more info, watch them carefully.
Being a detective, noticing the little things others miss.
It is, and also that feeling of something's not right, even if you don't know why yet, that comes with time.
Any advice for new nurses trying to get that instinct?
Ask questions. Never be afraid to ask someone more experienced or look it up. The more you know, the better your gut feeling gets.
That's good to hear. We never stop learning, right?
Never. And it's not just from books. Communication matters too. Writing down what you find, clearly, that's just as important as finding it.
Yeah, if you solve the mystery but can't explain it, what good is it?
Exactly. A good nursing note, it's like painting a picture with words so everyone understands what's going on.
I've heard those notes can be as helpful as a test result sometimes.
Totally. They show patterns, changes over time, what needs more attention. It's telling the patient's story accurately, but also so it makes sense.
Like taking all those assessment pieces, making a tapestry, the whole picture of their health.
Beautiful way to put it. And it's not just the physical stuff, it's what the patient's saying too. Their worries, their hopes, all of it.
So we're treating the whole person, not just a list of symptoms.
That's what makes assessment so powerful. You build trust, understand their needs, care for them, not just a disease.
This has been eye-opening. Assessments are way more than I realized.
It's more than boxes to check, vital signs. It's being present, curious, connecting with the person, listening to them, fighting for them.
And never stopping learning.
Exactly. That's the nurse's journey. Knowledge, compassion, always striving to be better.
I think we've covered just about everything on assessments. For now, anyway.
The basics, for sure. How important it is to think critically, communicate well, see the whole patient. But like all of nursing, there's always more.
That's what's exciting, right? Always something new, always growing, always ways to help people.
Absolutely. So to anyone out there wanting to be a nurse, keep studying, keep asking, and never forget it's about people.
And to our listeners, thanks for diving in with us. Hope you learned something and maybe feel inspired.
It's been great sharing this with you all.
Until next time, stay curious, care for others, and never stop learning.